Hi, my name is Hugh Hall, and I'm the administrator at Westview Nursing and Rehabilitation Center, and I have been here for a little over 14 years. I think the favorite part of my job is the diversity. Every day is a different day. We get to deal with wonderful patients and residents and their families, staff concerns. I think putting Westview's mission to work is something very exciting to me, and I think we've seen some great strides in Westview improving how they do business by being a mission-driven organization. So that's very exciting to me. I think we've promoted Westview as being the nursing home of the future, particularly because of our innovation. I think we have, again, a staff that's very mission-driven. I think they're excited about new happenings in long-term care and short-term care services, and they work really passionately about implementing the mission, vision, and values. And I think some of our innovative activities, mentioning the ACT program, which is first of its kind in Rhode Island, and I think in the Northeast. We've been doing that for about 10 or 12 years. Implementing some particular programs within our rehabilitation services, doing gene site testing, using some new wound care techniques have really reaped some very positive rewards, and I'm excited by that. And I think the fact that we're innovative, that we're interested in trying new and different things, really puts us in a position of being the nursing home of the future today. I think Westview and its rehabilitation services are unique for several reasons. I think Westview was one of the earlier facilities to move away from contract services and bring their services in-house. So all of our therapists are Westview employees, and I think that's really important. Again, being a mission-driven facility, having staff, a great set of professional staff in our rehabilitation department who espouse our mission, vision, and values and work very hard at implementing those. I think, again, a uniqueness in our rehab program is the fact that we work toward discharge on the day of admission. They're very driven for our short-term patients to get back on their feet and to get home. And they work collectively with our nursing staff and the rest of the facility to put a plan in place to move that forward. I think the other side is post-discharge, and our rehab staff is involved in following our patient post-discharge to make sure that they're successful in the community. And we've had great success with successful discharges to the community, far in excess of state and national numbers. We're excited about having developed, I think, a comprehensive discharge plan to best assure a successful discharge home. And that discharge begins, that process begins upon admission. Our clinical team works very hard to assess the patient, to identify their needs, to get them back to their baseline, to get them to a point where they're going to be successful returning home. And that's what drives the plan. And we meet with the resident and the families. We have relationships with home care companies that come in prior to discharge and meet the patient and get to know them and understand their needs in the community. Once a discharge occurs, our staff follows that resident for the following 30 days, making phone calls, following up, and really following up with the home care company to make sure that all of the systems we put in place are actually happening, assuring a permanent placement back home. And in the event that it may not be successful, we're there to assist the home care provider and that individual return back to Westview for some additional services and care. So all of that combined has really assured us of getting people home safely and successfully.